Now to our health. Today we're talking about a fairly new weight loss surgery that's being offered right now only on our side of the state.
That's right. Dr. Brian Gluck with Mercy Health Partners in Muskegon is part of our expert team for weight loss. Today he's here with two of his patients, Kelli Bylsma and Melina Schwartz.
Yeah, welcome to our studio.
Thank you for having us.
So, Dr. Gluck, let's start with you. What type of surgery are we talking about when it comes to weight loss that you're doing?
Well, this is a new procedure called the gastric plication. And what it involves is making 2 or 3 folds in the stomach. And what we end up doing is reducing the volume of the stomach 80%. So stomach can't hold as much, patients eat less, they get full quicker, stay full longer, and certainly lose weight.
Did I read it's only about 4 ounces of food that can be held in there compared to what with a regular
1,500 cc's, 32 ounces.
Wow. That's drastic. That is
so
drastic.
The beauty of this procedure is there's no cutting, no stapling, no removing of the stomach, and it is potentially reversible.
Wow. There's so many people that are interested in procedures like this, but who would be the candidate that you're looking for?
Well, also the nice thing about gastric plication, it is for a lower BMI patient, moderately overweight. Usually for the procedures, for most bariatric procedures, we do them for patients who are 80 to 100 pounds overweight. For the gastric plication, we're able to do them with patients with BMI of 30, and that's about 50 pounds overweight.
Okay. So that's a good option. We have 2 women in our studio today that have actually had it done within the last year. So all of this is really fresh, a lot of changes. Let's start with Melina, because you had it done about 11 months ago?
Yep.
Okay, so what made you really decide that this was something that you wanted to do?
Well, I had tried like medical weight loss and just regular dieting and everything like that. Nothing seemed to have been working. My main thing was I have a daughter. She's 11. She started soccer, and I couldn't even help, practice with her or anything like that. So.
And this is a picture of you before?
Yes.
And you are how many pounds lighter today?
About 70.
Wow. You look fantastic.
Thank you.
That's a huge, huge difference. And Kelli, you also underwent the procedure.
I did.
Tell us how it's affected your life, changed things. I think we have a few before and after pictures of you as well.
Yeah. My life before was a struggle with weight since I was in junior high. And I just felt like I was wasting the body God gave me and wanted to do something that would permanently make that line in the sand and say, I am not going to weigh any more than what I do now. So I had to do something. And my husband now, since the surgery, says that he can wrap his arms around me, feel every rib, and that's just really encouraging to me. So
that's wonderful.
Yeah.
Going in, there are a lot of different reasons why someone hesitates. Were there anything that you had to overcome before deciding to say, this is what I'm going to do?
Yeah, I think for me it was, there has always been a bit of a stigma to weight loss surgery, and I didn't want to have to deal with those feelings of being the easy way out that you've heard people say, and I really found that that's not an easy way out. It was a tool that I could use then to help lose the weight that I needed to lose.
Yeah, because it's still difficult.
Yes.
It's a change, a lifestyle change.
Yeah. It completely is. It kind of helps you relearn how to eat again normally instead of, shoveling it all in kind of thing. So.
Well, Dr. Gluck, so this is a lifestyle change. This isn't an easy fix like your patients are saying. So this goes hand in hand with healthy eating and also exercising as well.
Exactly. And at Mercy Health Partners in Muskegon, we teach lifestyle change as well with any weight loss procedure we do, and that is key. If patients don't get the lifestyle changes, they're not going to be successful with the surgery.
Let's talk about this type of surgery too. It's the folding of the stomach as opposed to the removal of things from the stomach. What are advantages of doing it that way as opposed to the many different other ways that you can do this surgery?
There's no rerouting of the intestine as with the gastric bypass. We're doing a sleeve procedure where we remove about 80% of the stomach. There's no removal of the stomach here. The stomach is all folded in. If the patient needed it, if the patient wanted reversal, we could potentially take out those sutures and reverse the stomach, and you'd have your stomach back again.
And the reason why so few doctors are doing it in Michigan is it because it's new, or because it's extra challenging? Or?
Well, a little of both. We're involved in clinical trials at Mercy Health, and we're looking at the short and long-term results of this procedure, and hopefully what we're seeing now, as you see, is excellent results, and hopefully the procedure will become mainstream, just like the Roux-en-Y gastric bypass and the sleeve.
Well, with summer here, I know that so many people are experiencing the same thing that you were experiencing, and they want to feel a little more lively in the summer and throughout the rest of their life. If they have questions, you have a seminar coming up that people can get a lot of information at.
We do. We have a seminar at Mercy Health in Muskegon, July 12th. It's from 6 o'clock to 9 o'clock p.m. Just call, make a reservation, and anybody's welcome to come.
Yeah, so that'd be a great step in that direction of asking questions about what it entails and who qualifies. So thanks for coming in. You guys are amazing.
Thank you.
You look
Congratulations.
awesome.
You look wonderful.
And this sounds really interesting. Thanks for sharing.
Thank you. Thank you.
We'll be right back.
This is 8 West.